Okay, I'd like to call to order this meeting of the First Five Sacramento Commission for Monday, August 5th, 2019. Madam Clerk, will you please call the roll and establish a quorum?
Dave Gordon.
Here.
Beth Hassett. Terrence Jones.
Here.
Olivia Kassiri. Bruce Wagstaff.
Here.
Scott Moak.
Here.
Donna Sneringer. Steve Wirtz.
Here.
Lee Turner Johnson. Kathy Kosick.
Here.
Terry Porter.
Here.
Christina Elliott.
Here.
Patrick Kennedy. Phil Cerna.
Here.
We have a quorum.
Thank you.
And with Commissioner Hassett being out today, Commissioner Wirtz will be voting in her place. And with Commissioner Kassiri out, Commissioner Kosick will be voting. This meeting of the First Five Sacramento Commission is cablecast live on Metro Cable 14, the local government affairs channel on the Comcast Consolidated Communications and AT&T UVerse cable systems. This meeting is closed caption and webcast at www.sapmetrocable.tv. Today's meeting will be repeated Wednesday, August 7th at 9 a.m. and Friday, August 9th at 2 p.m. on Channel 14. Members of the audience wishing to address the Commission may sign a speaker slip at the kiosk located in the back of the room. Please include the agenda item number that you wish to address and then bring the completed form to me. Please speak into the microphone when addressing the Commission and state your name for the record. If you have any electronic devices, please put them on silent or turn off now. Thank you.
Thank you. Please rise and join me in the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, before we get started, just another reminder for those that may have entered chambers just in the last couple minutes. We do certainly invite you to address the Commission on any item that's on our printed agenda or any item that is not on our agenda. We ask that you keep your comments to 3 minutes, and we have that time limit in place so that everyone has a chance to address the Commission if they so wish. So with that, our first item, please.
Approve May 6, 2019 draft action summary.
Okay, any member of the Commission wish to make suggested changes? If not, entertain a motion. Moved by Commissioner Jones.
I'll second.
Second by Commissioner Kosick. All in favor? Aye. Opposed? Okay, motion passes.
Public comments on off-agenda items.
Okay, this is the public's opportunity to address the Commission on any item not on the agenda. I don't see anyone approaching the podium, nor do I have any speaker slips here, so I will assume that no one wants to address the Commission on an item then. Next item.
Executive Director's Report.
Okay.
Good afternoon, Commissioners.
Good afternoon.
It's been a whirlwind of activity over here since we've last met. Taking the summer off means you have a really long Executive Director's Report. But really good stuff going on, and I've asked Aaron to come up here and tag team it with me because there's a lot going on in our communications and outreach areas as well. I'll start with great news about our budget. So since we last met in May, the governor did sign a $215 billion state budget into law, and the budget aimed to improve the lives of children and families in California. For the first time ever, there was an early childhood section in the budget, which is a huge win. And the governor strived to make advances in what he's calling his parent agenda. So you can see in the report, I won't go through all of these, but there are many key elements of the budget related to our local and statewide First Five policy platforms, including a really huge investment in the child care area to expand child care. As a bonus, you'll see a picture in the Executive Director's Report. Our local First Five staff and partners even got to participate in the press conference where the governor signed the budget, and just showing that we have our growing connection to this new administration, and we're really excited about it. Also wonderful is that we have the First Five Association has a seat on the California Surgeon General's new Trauma-Informed Care Task Force. As you know, First Fives have taken a lead in ACEs science and trauma-informed approaches to all of our working with families. And so we really are excited to have a seat and partner with her in this new way. And then Prop 64 is being created a task force or advisory group, really, to look at the early childhood funding potential. So the governor took 75% of the Prop 64 revenue around prevention funds and allocated those to child care for children 0 to 12 years of age. It was huge, big investment, and that left 25% of the money unallocated, but we know it has to go to prevention. It's under the prevention, which also includes treatment, and the folks around the table are pretty loud on the need for treatment, and so our First Five Association is applying for a position at that advisory group, trying to keep the focus on prevention and early intervention with families with young children. That's the upside. The downside is that as a participating member, that guarantees that First Fives cannot actually receive any of this funding, that 25%. But that doesn't mean that our partner agencies can't across the state. So that's what we would be really lobbying for here, is that funds go to directly serve children and families through all of our funded partners. In census news, jumping to census news, we were really relieved that the U.S. Supreme Court did not allow the citizenship question on the census. We know that an accurate count is so critical, and that census question would have probably hindered our ability to get that accurate count and really undermine the health and well-being of our youngest children, those children being one of the most undercounted populations in the state. And of course, you all know that many critical programs are funded through federal dollars, like Section 8 housing and Medicaid and Head Start, and all kinds of good stuff. So it's really critical. We're working hard. First Five is the leader in convening our 0 to 5 subgroup. We continue to do that, and I send out bi-weekly, probably, emails on the census to all of our partners. Jumping to another topic, Chair Cerna recently received an Innovations for Children Award from Sierra Health Foundation for his leadership in both First Five and the county's efforts to reduce African American child death. So while we all know he's a champion for children, now even more of the world does know he's a champion for children. So congratulations. Put a short little blurb in your ED report about our work on the development of a local child abuse prevention plan. So cabinet of more than a dozen stakeholders from key county departments and nonprofits are convening to create this groundbreaking document, which seems like we should have had one already, and we don't. So we're really excited to get this off the ground. CAPC is taking the lead in this and has already applied for 2 additional grants to try to build some infrastructure and capacity around implementation of a plan. And First Five really plans to use it as our guiding document when we go out to bid in 2020 for our effective parenting contracts. So more to come on that. And our timeline to have that is hopefully the spring 2020. I'm going to turn it over actually to Erin to talk a little bit about our business journal partnership.
Hi, good afternoon, Commissioners. Thank you, Julie, for letting me share a little bit about all the great work the Commission has been doing. First off, I want to touch upon the SAC Business Journal partnership that we had that was spearheaded from the 20th anniversary. And the current campaign elements, as they are rolled out, Julie has been sharing them with you. And the first was On the Record, which is a series of 3 print articles. These articles, one, were able to highlight about First Five Sacramento and do an invite to our certified sustainable graduation. The second one was able to feature the graduation and highlight our funded partners. And the third piece is included in your packet. It's the family-friendly piece. And what's nice about these is that moving forward, we can also use these as standalone pieces for our future outreach with the business community. And the next part of this campaign is going to be an online series of 6 articles where we'll dive a little bit deeper into what is certified sustainable and what are those domains and how and what that means as a nonprofit and what that means to businesses. So we're glad to be able to get that message out. Then, of course, layer that with some family-friendly business practices and also the importance of the economic investment in the early years. So it's been a really great partnership. It's taken a long time to build, but during that time, I know it's going to be great moving forward. And an example of that, to piggyback off this, all our business outreach and partner development since the 20th, is organizations and associations that have been reaching out to us, either to hear more about our sustainability or how they can become family-friendly as a business. So thanks to Chair Cerna, Julie was able to present to the Midtown Business Association. Tomorrow, we're meeting with the Franklin Business Association. And some other organizations we've met with are the River Cats, the Sac Republic FC, about family-friendly areas. And thanks to Commissioner Moak, we know he's got our back in making sure that that new stadium is going to be some 0 to 5 stuff in it. So just looking forward to working more with the businesses. If there's any businesses that you want us to reach out to, any boards that you serve on that you think that would be interested in hearing more about First 5 sustainability and family friendly, please let Julie or I know. Put it back to you.
Thank you. I'm gonna now talk a little bit about our school readiness developmental playgroup findings. So the full report is attached to the executive director's report, but I just wanted to go over some brief highlights of it. Our evaluation committee received this document at our last meeting, and although we've funded playgroups for nearly a decade now, we've never actually looked at it as a standalone strategy and what works and what doesn't and how we could potentially make them better. So this was our first endeavor to do that. Playgroups are one of 5 strategies that our school districts implement in our early learning priorities. So other things are like preschool enhancements, kindergarten transition activities, parent education, and developmental screenings. So the highlights include that this is really a no-brainer, but came out loud and clear, is the most important thing about a playgroup for parent satisfaction and teacher satisfaction is location, location, location. So the successful playgroups that had the highest levels of satisfaction were actually located on very busy elementary schools or preschool campuses with lots of parents and kids coming by and easy recruitment, and that they had a dedicated space on that campus for the playgroups. The next most effective and highest rated, even if they didn't have a dedicated space, they had a facilitator who could create a warm and embracing environment, even in a mobile space or a temporary space, or even like a cafeteria sometimes. But it was really all about creating like little playgroup stations, almost like a preschool where you could travel around and participate in the different stations. So having that sort of preschool feeling was rated very highly. The 2 biggest barriers for playgroups was lack of awareness, so they did have some recruitment problems, and transportation, so parents who knew about it just couldn't get there. So those 2 things were the barriers. And then the report provided us with some really great recommendations. Some of them we actually just enacted immediately because they made sense to do so. And others we will probably incorporate into our next strategic plan and the competitive bid process that goes out if we continue to fund playgroups as a strategy. So just a couple of those recommendations were definitely to locate the playgroup sites at preschool and elementary sites with designated classrooms, allowing the school districts the flexibility to determine where and when their playgroups would be held. That we actually took that recommendation now because we had some rules about 50% of the classroom, 50% of the sites had to have play groups, and some of them were just not successful. So allowing the school districts the flexibility, so the same number of children being served, but in fewer sites, actually increased the quality of all of the sites that were served. So, and then other things like staffing, having playgroup teachers that were very enthusiastic and could foster, fun and good times while engaging both the parents and the kids. That was critical. And for infrastructure, little things like greeting the families in their own language in a circle time to start off every single playgroup. Creating developmental playgroup multidisciplinary teams that can help with referrals and triage families when things were not going well for that family was really seen as a something that should be standard across all of them. Administering our ages and stages questionnaire and the social emotional side as well, so that kids could be screened and picked up for early issues, and then doing one-on-one connections with the family member and the teacher for when they did pick up behavioral issues or developmental issues because of the fear and other things associated with that, stigma and stuff. So the full report's in there. Those are just a couple highlights. I'm almost done, but I have a few staffing updates to share too. We did hire our early learning coordinator. Lindsay Dunkel will join our team in 2 weeks. She was the executive director at First 5 Nevada County. She is amazing, and I think will fit in really well with the culture of our team at First 5. And I really think that she'll be accepted and valued among our contractors as well. Michelle Peterson, who's been with us for nearly a decade, is going to retire early next year. No amount of arm twisting could keep her on board for any longer. So we'll be figuring that out, and you might hear more about that. And then I'm also reallocating our chief of admin position, Eric's position, back to an administrative services officer position. So when Kim Kenzer left, I had downgraded that position to an ASO3. And now with us taking on CalWorks, it's such an intensive and big and complex program. And when we lost our our senior auditor, accountant, we didn't replace that position with another, and we downgraded that position to a clerk position, a tech position. So Eric also had to take on a lot of that work. So bringing that position back up, and actually it will be funded by CalWorks, because that's primarily the work that he's doing now that he wasn't doing before. Okay, and then please join us on August 21st for a screening of Chocolate Milk, the documentary. This 2-hour event will be opened by Chair Cerna, and we'll have time for questions and answers after the film, which is, of course, related to breastfeeding among African American women. Now, just back to Erin again, really quick.
Thank you, Julie. I'll wrap up with some communications highlights that we've had, and one is just touch upon the great partnership that we've had this past year with First 5 California and the Sacramento Kings. And this involved a lot of community events, 4 to be exact, which was great exposure. The last one was at La Familia in June, and the other 3 events, 3 out of 4 included our legend Olden Apollines, who is now the biggest First 5 fan. He actually requests to come to Sacramento for a First 5 event, so that's really awesome. He was there at the Pride and Joy. Doug Christie was at Dr. Seuss. Olden was at the Oral Health School Day event, and then at the La Familia event. So this was so successful for First 5 California and beneficial for Sacramento, because who else is going to carry out these great community events, that they're looking to renew this for a 3rd-year contract. And I want to thank the commissioners that were able to come to some of the events. If you have any feedback and want to share, it's always helpful to give that feedback to First 5 California. And then also want to touch upon the Help Me Grow digital campaign that we launched this year. So later in the meeting, we will hear from Help Me Grow. They're going to do a presentation on their first year of this program. And so to really kick it off, we wanted to layer it with a digital campaign. So throughout reports, I've been mentioning what our partnership with Intercom and the elements of the digital campaign. You will see some of the web ads, and we will show the pre-roll during the presentation. But overall, this campaign, we wanted to run it in alternating months so we could actually see what the impact was to the website and to the call line. And I have results from Intercom about the different impressions that were delivered. It was 1.2 million from the web ads, over 100,000 from the pre-roll. And if any of you want to know what a pre-roll is, when you're online and you want to watch a video and you go to click the video and you have to wait and wait and wait through what that commercial is and you get so annoyed, you don't when it's your own commercial. So that's what a pre-roll is. And ours was 15 seconds, so it was short. So there was no skip ad option for us. So that was nice. But some of the results from Help Me Grow from this campaign were just absolutely amazing. During the months that the campaign ran, there was a 27% increase to the phone line. And during the same months on the website, there was a 789% increase to web traffic. So for first year of this campaign, I know you probably see smiles in the background there. What a great campaign. And so lastly, let me wrap it up with social media. Attached to the Executive Director's report is a snapshot, just a snapshot of the annual metrics, and then a monthly look at June's results. We get a lot of analytics, and I'm going to try to bring to you the information that you need. If you ever want this full report, just let me know. It's 32 pages of great analytics and metrics that I can send to you. But I just wanted to touch upon some of the highlights in the last year with our social media activity that is across several platforms. And our newest one, as part of our sustainability plan, was the launch of LinkedIn. So I'm very happy that we have LinkedIn because it's reaching a different audience, a business audience. And throughout the past year, the highest liked and shared post was our 20th anniversary video that features Commissioners Elliott and Cerna. Another thing we did is incorporated Instagram stories and then increase our visibility on Twitter by partnering with Moms Rising on the parent advocacy group on their national Twitter chat parties. So that's been really nice just to have different options on different platforms. And let me just highlight, as I close it out, a few of the notable posts that really increased our followers by up to 30%, increased our impressions by 5 times. That was in January around the 20th anniversary. In December, the RAACD evaluation report, anything about Help Me Grow, and EITC, and then the governor's proposal in May. And so that concludes the communications report. If you have any questions, if not, I'll just pass it back to Julie.
And that concludes the executive director's report too.
Julie and Aaron show. Okay.
Yay!
Okay, any questions for either? Not seeing any. Very thorough, thank you.
Yep.
Okay, next item, please.
Advisory Committee update.
I can give a quick update on that. We selected 2 representatives from the advisory group to join Commissioners Wirtz, Moak, and Hassett on our strategic planning work group. That's Alexandria Page and Katie Andrew. We'll round that out, so those will be our 5-member group. And then I presented along with Divino Lopez from the U.S. Census Bureau. We did a census presentation to the committee members and answered questions and through that. So that was pretty much it.
Okay. Any questions on advisory committee? Seeing none, next item.
Evaluation Committee update.
Thank you. First, let me just say, yeah, that was an impressive executive committee report, and it's just so, or executive director report, and it's so amazing the work you're doing, we're doing with our communities around the variety of issues around trauma and around providing services. So it's just impressive to see the integration of that. So thank you. The evaluation committee met on July 15th and had a productive meeting there with a quorum. We touched on several things. I won't say anything about the school readiness play group piece because we're going to see about that later. I will just make the side comment that the report was quite well written, and as the committee is used to, I had very few comments to make about this report. So it's a sign that I was certainly impressed with it. In addition, applied survey research always goes through the variety of activities that they're involved in. The reducing African American child disparities, we worked on the indicator list and looked at trying to make sure that we try to put the RBA into a form that people can read and see progress on. As we said, school readiness and then birth and beyond. We continue to look at how data is being integrated into Persimides around this and looking at their outcomes as well and preparing for the next round of what are we calling it, the reboot of the work group to look at how to do the evaluation for birth and beyond with our partners in with the county as well as our Child Abuse Prevention Council and their team. And we always look at sustainability. We tend to make some suggestions around those issues. We don't always have a representative from sustainability there, but we are always thinking about ways to make recommendations to continue that dialogue. So, and I think with that, that covers most of what we covered.
Good job.
Great. Thank you. Any questions for Commissioner Works? If not, next item, please.
Financial Planning Committee update.
Good afternoon. We met on the July 18th. We reviewed the quarterly financials through June 30 and were pleasantly surprised that actual expenditures resulted in an improved fund balance. That will be reflected in the financial plan, which will be coming before the Commission today as an item number 8. We also were notified that a new time survey management study for the Medi-Cal administrative activities has been chosen to replace the outdated current system. It's called Time Study Buddy, and it will be implemented October 1st. It has real-time reporting and electronic signatures. Staff reported a continued implementation of the home visiting initiative. I believe at this point there are 70 total clients being served, and it's a slow process, but everything with the documentation requirements are being implemented into the process. We also reviewed the adopted budget and the 10-year financial plan, and we unanimously approved that. And again, that's item number 8 in your agenda today.
Thank you. Next item, please.
Sustainability Committee update.
Okay, hi, good afternoon. As you all know, there was a certified sustainable graduation that was held in June, and so members of the Sustainability Committee supported staff at that event. I wasn't able to attend, but I heard glowing reviews about Donna, who I'm reporting out for her today. She did an amazing job. I'm sure none of us are surprised by that. We're pretty sure we're going to be meeting August 20th. We're still working out the time, and we're going to preview the Sustainability Evaluation Report and the final report for Certified Sustainable Initiatives, both to present to the Commission. Both will be presented to the Commission in October, so we look forward to bringing that before you all then, and happy to answer any questions if there are any.
Great. Any questions for Christina? Don't see any. Thanks.
Yes.
Okay, next item, please.
Public hearing, approve adopted budget and 10-year financial plan for fiscal year 2019-2020.
Great. So you've got me doing this one today. Eric had a death in his family, actually, and he is in Ohio with his mom right now. But he totally prepared me, and so I think this will go smoothly. You have the letter, and then you also have 3 attachments, and we're going to kind of walk through each of those. The adopted budget is used to capture any changes that from the time when we did the recommended budget back in May. And these changes are primarily due to the timing of the state budget being passed, and include sort of any recent developments in our funding levels. And as you remember, the commission approved the recommended budget in May, and the Financial Planning Committee reviewed this document and is sending it to you for approval. So let's start by looking at attachment number 1. Eric did a wonderful job on this, and if you just look at the top half of this, you can see where the changes are. They're very minimal changes. The top of the sheet with the 3 columns, there's the recommended budget column. The changes are in green, and then our requested adopted budget. So the only changes made here is in the contracts line item, and we're asking for the $1.6 million increase in that line item, bringing it to a total of $21.6 million. The changes to that are called out in the green box below. So it's funding for programs including our Perinatal Equity Initiative campaign. We received the money last year, but we won't be launching the media campaign until the fall, so we need to roll that money over. And then we're also carrying over the fluoridation project, which we expect to be finalized in December of this year. And we had a reduction in a school readiness contract. Thank you, Robla, because Robla Unified, as part of their sustainability efforts, were able to enact them now and saved us the $20,000. So good job. So those really are the only changes that we have on that side of it. And then if you look at attachment number 2, you will see in the, there's a green row, that row is now reflected the $21.6 million. That's our new amount, which encompasses the changes in those contracts that we just talked about. Everything else in attachment 2 remains the same. And then I'm going to take you, before I take you to attachment 3, as part of the budget process, we also calculate out our fund balance each year. And Commissioner Cossack made mention that we have good fund balance news this year. So these are the funds that we typically have allocated in the year and then didn't spend them. So if we allocated $20 million and only spent $19 million, then we'd have $1 million in our reserve. Or if we bring in more revenue than we had anticipated, if we calculated 10 million, got 11 million, that's an additional million that would go into our fund balance. So in this year's adopted budget, our fund balance did change from the recommended budget. And if you look at that attachment 1 again, in the yellow column, that was our projected fund balance was about $1 million. And then if you look over into the blue column, you'll see that our actual was closer to $3.8 million.
Nice.
Which is lovely. So that's primarily due to some of the rebudgeting of the contracts and also an increase in revenue from MA, as well as increased returns on our interest rates. So we did well. And then to see how it sort of plays out, that new fund balance plays out in our long-term financial plan, if you look at attachment 3, you'll see that the dark blue row in the 2018 strategic plan column shows the now nearly $3.8 million there. And below that, it has a $5.4 million reserve release. So that changed for the better our year-end reserve balance, now 18.7 million, and it was about 17 point something million. So that's good news there. And then the other peach highlights are also good news for us. So we were able to increase the amount available for future allocations in the next strategic plan by $460,000 per year as a result of that. And it also decreased, the other peach little box is a decrease of our strategic plan reduction. That was 27% reduction calculated in the recommended budget, and now we're down to 25%. And of course, the more we can chip away at that, the happier we are. So those are the changes in the adopted budget, and I'm open for questions.
Any questions for our executive director? I have one question. I see people are starting to queue up here, but looking at attachment 3, under the 2019-20 budget column, the green column,
Yes.
the second largest amount under your revenue rows is miscellaneous at almost 3.3 million. What is that?
That's the CalWorks home visiting funds that are now routed through First Five and then provided to CAPC, with us taking out a percentage for our admin fee.
So in the future, can I make a suggestion?
Yes, sir.
That you treat miscellaneous as a row header, and then you have a you have indentation underneath that for exactly that qualifier, so the public especially understands what miscellaneous is. Otherwise, you leave the public with the impression that that's how we operate, is in the world of miscellaneous, and that's not
Good
really how we operate.
recommendation. Duly noted. Thank
Yeah.
you. Will
Okay.
do.
All right. Commissioner Wirtz.
Thank you. Just a quick comment on the savings, back to attachment 1. I think about, you said most of the savings are from the MA and interest rate change. Is the other, the fluoride, move from one year to the next?
Not really,
No.
because we anticipate that that money will be spent.
Oh, okay.
Yes, as well as the perinatal equity initiative dollars, we're banking on that actually being spent out. So this was MA revenue, interest income, and some sustainability dollars.
Okay, because that's a good amount from
It
MA.
is.
That sounds like that's, and CAPC does MA reimbursements, and who else? Or is that?
It's only related right now to our Birth and Beyond contracts. So it's CAPC and then the 9 family resource centers. And internally, we also bill for all of our time spent administering those contracts, where we're working on garnering MA funding.
Okay. And that's a part of our sustainability in a way, is it not? Yeah,
Absolutely,
yeah,
because
yeah.
it's anywhere between $800,000 and $1 million a year. So even though it is so much work, we're hoping that Time Study Buddy actually does make it easier. And we now have Stephanie Wills joined our team as an account clerk, or account tech, as I mentioned, and she's really able to pick up a lot of the extra MA-related work. And so we were actually able to bill 2 additional quarters, which is why we received more funding, so we're getting caught up in our MA. But it's absolutely one of our sustainability items.
Yeah, good. All right, thank you.
Sure.
Commissioner Wagstaff.
Thank you very much. Thank you, Julie, for the presentation. And I might have missed this, but effective parenting, which is the largest expense category. Can you just summarize again what's included within that?
Yeah, so that is Birth and Beyond for the 9 family resource centers, as well as our sort of financial fiscal oversight contract with CAPC. And then it also includes the about $1 million in funding for the 2 crisis nurseries.
Okay,
I think that's it. Yep, that's it.
okay, thank you.
Sure.
Okay, any other questions for staff? If not, I entertain a motion. There's no one signed up to speak on this matter.
I'll move the item.
Moved by Commissioner Gordon,
Second?
second by Commissioner Wirtz. Roll call vote, please.
Dave Gordon,
Aye.
Steve Wirtz,
Aye.
Terrence Jones,
Aye.
Kathy Kossick, Bruce Wagstaff,
Aye.
Scott Moak,
Aye.
Phil Cerna.
Aye.
Motion passed.
Great, thank you.
Approve strategic plan consultant contract.
You've got Carmen on this one and the next one actually as the lead for both of these items.
Good afternoon, Commissioners.
Good afternoon.
We would like to ask for you to authorize the Executive Director to negotiate and execute an agreement for strategic planning consultant services with Applied Survey Research. They will facilitate and produce the 2021 strategic plan, and the contract will be a 9-month period beginning August 19th and ending May of next year. The maximum payment we're asking for is $19,000. On May 6th, the Commission appointed a strategic plan work group. And at that time, we also said we would release a request for applications for a strategic planning consultant to facilitate the work group. The RFA was released and we received 3 applications. It was a very competitive process. Our review panel consisted of 2 of the work group members who are also advisory committee members, and they selected Applied Survey Research. The strategic planning consultant will work with Commission staff to develop the work group materials, facilitate work group meetings, and produce the 2021 strategic plan for the Commission's approval in early 2020. The cost is $19,000 and are included within existing allocations for the fiscal year 19-20 budget. If approved, the recommendation will result in funding Applied Survey Research. This concludes my report.
Thank you. Any questions for Carmen? Commissioner Wirtz.
Just a quick one. So this would be integrated into their existing contract as an amendment, or will it be a standalone?
It's a standalone contract.
Okay, thank you.
Further questions? I have no one signed up to speak on this. Entertain a motion.
So moved.
Moved by Commissioner Moak. Is there a second?
Second?
Second by Commissioner Jones. Roll call vote, please.
Dave Gordon,
Aye.
Steve Wirtz,
Aye.
Terrence Jones,
Aye.
Kathy Kossick,
Aye.
Bruce Wagstaff,
Aye.
Scott Moak,
Aye.
Phil Cerna.
Aye.
Motion passed.
Thank you.
Approve amendment to Persimmon Incorporated contract.
We are asking for you to approve the executive director to execute a first amendment to the agreement with Persimmon to increase their allocation by $18,400. The reason for this is that we have been using Persimmon now for a number of years. I'm thinking 10 years
Literally
now, right?
since the beginning of
Since
time.
the beginning of time, yes. And so prior to July 1st of 2018, Birth and Beyond was using another contractor to hold all of their data. And as of July 1st, 2018, Birth and Beyond transitioned into Persimmon. So now we have access to all of the data and all of the various data collection tools that they use in Persimmon. This increased, as you may understand, this increased the data that is stored in Persimmon by a huge amount. And so in addition to that, also with the CalWorks home visiting initiative being implemented also within Birth and Beyond and through First 5, this has increased the amount of data collection and storage as well, because we are now using additional data collection tools in Persimmon. So this requires additional data collection tools that have been set up in Persimmon, and as well it requires additional technical assistance provided by Persimmon. So we are recommending additional funding for Persimmon International Inc. in the amount of $18,400 to fund the additional services provided for technical assistance in data storage and reporting required for Birth and Beyond. If approved, this recommendation will result in funding of Persimmon International. That concludes my report.
Okay, any questions for staff? Is there anyone from the public that would like to speak to this item?
I think Dr. Wirtz has one.
Oh, okay. Commissioner Wirtz?
Yeah. Thank you. Carmen, thank you. And you have done an incredible job of using Persimmon to improve the data that you bring to the executive committee, and I think that's, and to our evaluators. So one, I think that's really super. And two, certainly I see the need for this expansion. The question I'm going to raise around Persimmon is whether you're feeling now that you have, under this, $250,000 contract, sufficient ability to ask them to make improvements in the system to help us ultimately with some of the questions that arise in the evaluation committee around following our clients from one service to another, aggregating across the level of intensity of our involvement with our families. Do you feel comfortable that you're getting the flexibility and the responsiveness from Persimmon to carry out some of these improvements in our ability to track outcomes?
I have an ongoing conversation with the owner of Persimmon, and I maintained monthly contact with him and ask him for updates and also improvements. They have made some changes to the system, and where there was some problems, and so I've had to have more of a hands-on approach with them. We currently follow clients from services to services, so we're able to look at how many of our school readiness participants also participate in effective parenting or in any of our other programs. That's something that we have done for quite some time now. I think the biggest issue that we continue to have is the duplication of those served. So while the system may say there are 60,000 individuals in the system, there may be 50,000 because 10 of those are participating also in various other programs. So that is an issue that I continue to raise with Michael Kugas from Persimmon, and I will continue to talk to him and see what can be done. We are going into a new strategic plan period, which allows us the opportunity to maybe look at other databases. It kind of is a nightmare for me, but if it's something that the evaluation committee wants to look at, we can certainly look into that.
Well, we would certainly be conservative about changing, but I think that I'm, $290,000 to, in one sense, I'm thinking that the platform exists and it runs sort of not on its own, but through your agency's involvement. And I'm just wondering that over time, we've had desires to have them work with us on, sort of a unique identifier. And I know some of these may be more legal counsel issue around that, but I'm just hoping that flexibility remains within our contract, that we can expect that they could make systems change under this amount of money as opposed to just sort of maintenance. So if that makes sense, it's just an ongoing concern that we have, that the more flexible our data system is, the more responsive we can be to the commission, to our provider network, and more importantly to our community and to our clients. So,
yes, thank you. I've made some notes, and I will continue to have that conversation with him.
yeah, super.
All right, any other questions? If not, entertain a motion. Moved by Commissioner Wagstaff.
Second.
Second by Commissioner Gordon. Roll call vote, please.
Dave Gordon,
Aye.
Steve Orts,
Aye.
Terrence Jones,
Aye.
Kathy Kossick,
Aye.
Bruce Wagstaff,
Aye.
Scott Moak,
Aye.
Phil Cerna.
Aye.
Motion passed.
Great, thank you.
Presentation of Help Me Grow.
I'm delighted to invite our partners from SCOE to come up and present to us on Help Me Grow. As you know, Help Me Grow started as Project SOARS back in 2013 and has evolved over the time, and Aaron did allude to some of our successes, but Natalie Woods-Andrews here to share with us how we got there with those successes.
Great, thank you so much. Thank you, Chair Cerna and Commissioners. Very delighted to be here with you today to share about an important model that we're just very excited about, and that is through Help Me Grow. And as you know, Help Me Grow is a national model. It was adopted by First 5 California Association, brought here to California. We were one of those early adopters to be able to step into the realm of Help Me Grow because we were well positioned by one of your previous investments, and that was through Project SOARS, as Julie has just mentioned. And so we're able to build up on this model in partnership with a subcontract through Wormline Family Resource Center, one of our partners here today. So today I'd like to just highlight for you an update in terms of our first full year of implementation. So as you know, there are 4 different components in the Help Me Grow model. One is focused on child health care provider outreach, one on community and family engagement, another on a centralized access point, and the last piece has to do with data analysis. And so I just want to quickly unpack these 4 components with you. The first is on the child health care provider outreach. And this is our opportunity to really connect with those who are providing medical services to our young children and families. Oftentimes we hear from our medical providers that they conduct maybe a screening, or they may know that there's something that might be wrong with a child, but they're not quite sure where to refer that child for developmental follow-up or for behavioral follow-up. And so we've been able to establish a partnership with medical providers, number one, to really highlight the importance of those developmental screenings, and then after that screening is conducted, that there is a place that they can connect with and that family can connect with that will do some additional follow-up and then circle back around with the provider and with the families to make sure, number one, that they're connected, but also to communicate back with the healthcare provider that there was a connection that was made. So we are able to make sure that we connect with our providers, and that has been a big focus for this year. This year, we've had an opportunity to connect with those providers that you do see on the screen. Kind of keeps blinking in and out. I'm not quite sure why. But you'll see we have a medical group that provides a number of services to those families receiving Medi-Cal. We have been able to connect with some very small providers, but also very large providers. You'll see Kaiser and UC Davis. I think it really is important that we take a look at multiple venues for engaging healthcare providers. They might be a private pediatrician, someone who just found us on the website, or someone who just heard about Help Me Grow, as our doctor that is at the bottom of the slide, Dr. Teta. She heard about Help Me Grow and just wanted to be involved, be engaged. Same thing with One Community Help. They found the information on the website and thought, you know, this sounds like a great opportunity to connect, and contacted us for additional outreach. One of the pieces that is also very important is that family and community engagement. We need to make sure that parents understand that there is a point of contact that they can go to if they just have questions about how their child is developing. With the resources that we've been able to provide for families, we have been also able to engage the community. So with our private providers, we have been able to give a little postcard to families, and you have a postcard in your packet, and you can see that on the screen. It is an outreach mechanism that just gives information that if you have concerns about how your child is developing or behaving, about talking or speaking, developing, that there is a number that you can call in order to get someone to answer some of the questions that you may have. Something similar that we have with our healthcare providers is a little prescription pad, so that you also have that in your packet, so that if a pediatrician is meeting with a family, they can just write a referral to that family to Help Me Grow, tear it off and hand it to that family, and then that family can actually just give us a call, just as they would do any other type of prescription. So this postcard serves as the same way.
Dr. Woods-Andrews, I just want to make sure someone's working on that. I appreciate you being able to blast right through that and not stop and with that blinking like that.
Yes.
But do we know if they're working on that?
Yes.
Is that what you got?
Yeah.
That's what you got up to date.
And it hasn't blinked for about a minute, so I think we're good.
Fingers
We're
crossed.
good.
Fingers crossed.
Okay. Okay, now I can.
There you go.
Thank you so much. Okay, so we do have postcards that are available as an outreach mechanism for our families, but then also our community providers. Okay, that's okay. I'm going to just keep moving forward. I think what's also nice is that as we have been able to engage our community, we have developed posters so that our providers and community partners can hang the posters in their agencies, again, as another outreach mechanism. So on this slide, you can see some of the partners in which we've conducted outreach at some of the major events. Some of them are hosted by First Five Sacramento, some connected to the Black Child Legacy Campaign, and some are just community outreach opportunities that we try to make sure that we're visible, that we're present in the community to start connecting families. And this is just, again, another opportunity that you can see on this slide when it displays of some of the outreach that we have been able to connect, not only with school districts, but also with some of the programs that are in existence here in the community. One of the things that I think is really important is that we don't see this as one more program or just another layer, but this is something that's embedded. This is an integral part of some of the outreach and some of the resources and services that are just offered in the community to children and families. The next piece is focused on the multimedia campaign that Aaron talked about early in the executive director report. And I tell you, this has been a contribution to great success in driving individuals to make a phone call or to just log into the website to find out a little bit more about Help Me Grow. So that as individuals are just waiting in DMV, for example, that little ad just kind of pops up miraculously and it draws that individual's attention to Help Me Grow, something that they would not have been aware of. Sometimes you don't know the questions to ask, and this is just a little prompt that's right before them in order to help build that awareness. And so we have received an increase in calls by 27% and 789% increase in just what draws individuals to the website based on this media campaign. So I'm really excited about that and hope that we have that opportunity to continue that type of outreach.
I think we have a question from Commissioner Wagstaff.
Thank you. Going back to that slide, I hesitate to ask, there you go. So is this the primary way that people make the connection with the program then from these types of contacts?
So this is one way that a connection is made.
Okay.
We do have a team of individuals that work with us, and we actually go out and make a lot of presentations. So I have a team of family advocates. I have a manager who is here as well. We go out and we conduct outreach for a number of individuals. So for example, we've been able to go out and provide information to 150 pediatricians through Kaiser in one shot. Or we go out to the medical groups and provide presentations to maybe 50 of their medical providers. We are going on a regular basis to some of our medical group providers and sitting with them to build that awareness. And then some of the outreach events that was displayed on a previous slide, we make ourselves visible in the community and actually just physically talk with families to conduct that outreach.
Do you have a cap on how many people you can serve in the program?
No.
Okay.
We don't, because I think for this first year, it's really important to build that awareness. And I think once we have a better idea of what the need is, then I think we can tailor our services and our support accordingly. But I think our main goal this year has been on outreach with our healthcare community and then also with families and with our community partners.
Thank you.
Mm-hmm. So on this next slide, this will be the digital media ad that has been displayed, and it's only a very short ad. Very short and sweet. So miraculously, it displayed the whole thing, right? Without blinking. That's great. So we wanted you to see the media ad because, again, it's just something very quick to grab an individual's attention and draw them to the website and also draw them to the phone number. And that's the next point that I want to talk to you about. We have a centralized access point, and even though it says point, we see it as a threefold connection. One, accessing the call center, and I'm going to introduce you to the team that hosts that call center. And then two, our family advocates. We have 3 family advocates who actually make that in-person connection with families. And then the third way is through the website. When our families are able to access any of those points, what is central in all 3 of those connections is that we want to make sure that that family receives a developmental screening through the Ages and Stages questionnaire or the Ages and Stages questionnaire social emotional, because that's what triggers that social emotional or mental health component that we want to definitely follow up on. It is also through these 3 different access points that families can receive information about developmental milestones, because sometimes it's not so much a concern about how a child is developing, but parents want to know what to expect, so we're able to provide them with resources as well. One of those ways is through a call center, and this is done in partnership with Warmline Family Resource Center, and Kelly Young, the executive director at Warmline Family Resource Center, is here, and then also Megan Murphy, who is the individual who actually picks up the call when those calls come through. And as you can see, that 886 calls have been received as of June 30th. In our first year of implementation, and over 400 of these calls have resulted in some type of a screening or referral. And one of the things that I think is absolutely essential, you can do the screening, you can do the referral, but you want to make sure that you're following up and that those families are actually connecting to services. And so that's one of the things that Megan and Olivia, they're able to do, because we offer it in English and in Spanish. They're able to do a 30-day or a 60-day follow-up with those families just to make sure that they have received the connection that they need. And then also even just ask that other question of, is there any other way that we can support you, or do you need any other type of assistance? Because oftentimes it's not just focused on their child's development, but there are some other concerns that that family may have. So we're able to connect the family in that way with follow-up. The other piece is through our family advocates. We do have 3 family advocates who do visit families in person, primarily those families who are in transitional housing or those families who are experiencing homelessness. We try to make sure that we are providing that intensive care, that intensive support to the families. Again, by providing them all of the information in terms of development that would support their child's developmental need, making sure that they do have a developmental screening, and then also making sure that we're connecting them through a referral and following up with the families. I think what's unique about this is that we're not necessarily meeting with families in their home, where they consider home. If a family needs to meet in the park, if they need to meet somewhere that is most convenient to them, we're able to meet that family where they are most comfortable in order to break down some of those barriers and provide that support. We develop a family action plan with that family in order to make sure that we're connecting them to the services. And then finally, the third part of our access is through the website. So we have a website, and you can see the URL on the screen. And we know that in this past year, we've had over 10,000 unique visits to the website, and 59% of those visits have been accessed on a mobile device. That seems the way to access information these days. So this aspect has been very instrumental in making sure that we are building that awareness. Help Me Grow is all about making connections. And this is just a visual graphic to show all of the various components of those connections that we're making with children and families, with our healthcare providers, and with the community. And I would like to introduce Megan Murphy. She's from our call center, and just share with you a little bit of information about how she has been able to support children and families as they've been calling the call center. Megan?
Excuse me.
Commissioner Gordon?
Yeah, the next section contains some data. Is there a way we can is there somebody who can fix this?
I already checked with the back, and apparently they have no control of it.
Thank you, Natalie. And thank you all.
Don't pay attention to the blinking screen. Just try to.
My eyes are on you guys.
We have the hard copies, so we can follow.
Awesome. Thank you, commissioners, for this opportunity to share a success story with you all in regards to our call center. So I'm here today to speak on behalf of the Help Me Grow call center. I am the main person that answers the telephone line. We also have a Spanish-speaking advocate on the line as well for the families calling in that are Hispanic and would like to speak to somebody in Spanish. So wonderful support there in dual language. Today I am here to share a wonderful success story with you, a family that we were able to connect with through the call center. And it's actually a little bit of a unique connection. I had the opportunity to go out to a community event through Early Head Start, where I was able to speak to families in regards to their children 0 to 3. I had many families approach me with questions in regards to how our program works, what services we provide, and how we will be able to connect them to services. So I had the unique opportunity to connect specifically with one family that I'm here to share that story with you guys today. So she shared herself through our connection and conversation that she herself as a parent was developmentally disabled and had 2 young children, one age 2 years old and one age 10 years old. So a little bit out of our territory of 0 to 5, but we try never to steer away families if we're not able to provide that service, at least telling them another resource that they can utilize. And so luckily for us, we have the connection with Warm Line Family Resource Center, who serves children age 0 to 26. So I was able to connect that mom for her 10-year-old to Warm Line Family Resource Center through that warm, seamless handoff. Since I'm housed in Warm Line Family Resource Center, it allows for me to make those seamless.
I'm going to interrupt.
Yeah, absolutely.
Here's what I'm going to suggest you do. Take this hard copy, use the white panel to your right there, and we'll use the camera overhead. Okay. Do you have a hard copy of the presentation?
I don't.
Take mine, or take someone's. There you go. And then if we can just have the digital overhead.
Just get rid of the power.
There we go.
Yeah, exactly. Let's do the page here.
Bounce anymore? Yeah, Natalie knows. Natalie knows this.
There you go.
Yay. Can you guys hear
Suggestion.
me okay? Yes. And we don't have the blinking screen at us. So we were able to, I am sharing this story with you guys. We have amazing stories through the call center that I would love to share all of them if I had the opportunity. But this one's very unique in that I was able to not only serve the 2-year-old who is within the age appropriate realm for our program, but I was able to support the mother and the 10-year-old child as well. So definitely, multitude of different abilities to serve this family. So this child came into our program after the community outreach event. I was able to connect directly with the family through the call center, in which we provided both the ages and stages social emotional questionnaires for the child, in which indicated a score that needed some further assessment. So at that time, we referred the 2-year-old child to Alta California Regional Center for further evaluation, in which he was found eligible eligible for multiple services, and ultimately was able to get the diagnosis of autism that mom was seeking. So that was wonderful. We were also able to connect the mother herself to Alta California Regional Center for services for herself, as well as a referral to Warm Line Family Resource Center to assist the 10-year-old child in accessing services through the special education system through the school district. So wonderful, example of the work that we are able to do with families every day. This mother was desperately seeking support for both herself and her 2 children and just had nowhere to go. So we were able to kind of take her under our wing, share all the different wonderful opportunities and resources available to her within our county for her to access for not only herself but her 2 children as well. So that is our success story, along with many others that we've experienced, as you can see through the statistics we're able to provide to you all through our first year of our Help Me Grow implementation. So thank you all for this opportunity to share a little piece of our success at the call center, and I look forward to many more.
Great. Thank you.
Commissioner Cernak, can I just say one thing? I'm pleased to hear the 2-year-old was able to get services and get to Alta, and just to recognize again the value of getting this early identification, and maybe they haven't been to a pediatrician or the pediatrician doesn't have enough information. This kind of outreach that allows you to get to this child early on really increases the chances that they will do much better than they would have otherwise. So that is really a success story.
Absolutely, yes. And to go off of that as well, about midway through, we were able to just do a little in-house statistics as far as listening to parent concern and how accurate that concern was. And our percentage was about 75% of families that called in with a concern did in fact show indicative results of that area being a concern area, making that referral for them for further evaluation, and then them being connected to services. So about midway through our implementation of our first year, we were already at about 75% accuracy from parent concern. And I would truly believe that those numbers are skyrocketing. Typically, each family that I speak to is dead on in regards to their child. They're their child's best expert, and we truly believe that. And listening to them and helping them get connected to those services, it's been beautiful to see those connections happen. So, thank you.
Thank you.
I think what has been key with this success story that Megan has shared, that it is not just one touch with that family, it's multiple touches and multiple opportunities to follow up with that family to make sure that they have connected with the service, and circling back to make sure that if there's something else that they need support with, that there's someone here who can support that family through. And so I just wanted to share a little bit more about some of the data components that are connected with this work. As you can see on this particular slide, as you just mentioned, Commissioner Wirtz, it is really important that children who are birthed through age 3 absolutely get connected early on. And you can see this first pie chart that talks about the different ages. The majority of the children that are being served through Help Me Grow are those children who are birthed through age 3. So again, just important for that connection. And then you can see in the center area, the children and the adults who are served through Help Me Grow, because again, we're servicing the whole family. Over 450 children have been served through Help Me Grow, and then you can see the ethnic backgrounds of those families. And then you can see also the majority of the families we serve speak English, primarily because of our capacity. There's a 15% that speak Spanish, and I would say there's a small percentage of speaking other languages, but I would expect that's going to be a growing need. And I think once we have that capacity to serve other language, we will definitely see that pick up in that particular area. So we do know that that is a particular concern for us. On this particular slide, you can see that we have conducted about 389 developmental screenings. Not every family that calls needs a developmental screening, and some families that connect with us, they already have a developmental screening, and so we're just able to read the results of that and connect them to the sources that they may need. This is just a breakdown of how many ages and stages questionnaires we've been able to provide and how many with the social emotional component. And then on this particular slide, you can see in terms of the developmental concerns and social emotional or behavioral concerns, about 321 referrals have been made for those two particular component areas. We do have a large number of families who call who also have concerns regarding social economic concerns. And so we're able to connect those individuals to the appropriate services here in the community. And then on this particular slide, as you know, I'm co-chair of the steering committee on reduction of African American child deaths that established the Black Child Legacy Campaign. And one thing that I'm pretty adamant about is that we don't see these programs or initiatives or movements as separate components. We have to bring all of this work together. So we are very connected to the targeted neighborhoods of the Black Child Legacy Campaign. And as you can see, over half of the families that we have been able to serve are in the targeted communities. And this is our most vulnerable population. So that is absolutely critical to make that connection. So the final aspect that I want to share with you, because you've heard from me representing the Sacramento County Office of Education, and you've heard from our Warmline Family Resource Center, but to me, no presentation is complete without hearing that authentic voice of a parent. And so at this point, I would like to invite a parent who has received services, not only through Help Me Grow, but also through the Warmline Family Resource Center, to share a little testimonial about the success of this connection.
They were all supposed to come up with me. I didn't expect to speak today, and I'm very nervous.
Don't be nervous, you're amongst friends.
My name is Kidada Medina. My daughter's name is Riley Jones. Approximately 8 months ago, we happened upon an agency called Warmline. Through Warmline, at the time my daughter was 2 years old, she's now 3. We walked in, I call it fate. Megan was there. Sid, who works with Warmline, introduced me to Megan, and they pretty much saved our lives. We moved to Sacramento to get help. My daughter was not developing normally or typically, and it required a lot of early intervention services like speech therapy, occupational therapy, child development. I became, I like to call it a solo mom by no choice of my own. And I wanted to make sure my daughter received all of the services that she needed to. When we came to town, we didn't know we came in under the guise of receiving help from a family member, which did not turn out to be the case. So, like I said, searching for resources, trying to get everything set up, so to speak, I happened upon Warmline. Never heard of it, never heard of Help Me Grow. And I remember the first day we walked through the doors of the Warmline agency, and Megan was there. Megan sat with me. They took Riley. Riley has autism, global developmental delay. She's very hyperactive. They're laughing because they know it's true. I felt at that point like I was going to lose my mind. Megan was phenomenal. And when she started talking about the success story, I thought she was talking about me, of course. But I don't have a 10-year-old. So I was like, oh, it's not me. So she sat with Riley. She started coloring. She walked me through they made connections for me at Alta to get my daughter evaluated. She actually went online. She brought her laptop over. She did Riley's application for Early Head Start. She did everything. It was such a burden that was lifted from me. She also, I remember her, I didn't even know what area we were in. She kept saying, this is Curtis Park, this is Curtis Park. And I'm like, okay. I didn't know where I was. She brought a map. She showed me the map. Then she told me about the crisis nursery. Again, those three agencies, Warmline, Help Me Grow, and Crisis Nursery, are the reason that my daughter and myself are still here today. I'm brave enough to stand before you and speak about it because there are other moms or other parents that are not brave enough to do so. Prior to having my daughter, I secretly judged news stories that came across the television. How could a mom do that? How could a parent do that? And then I found myself in that very same position, ready to just give up. It was hard. I received a lot of support, a lot of help. We've come a long, long, long way. I wish I was better prepared to present before you today.
You're doing great.
Because I don't want to forget anything.
Well, you can watch yourself on TV later. So.
Oh, that didn't help. That didn't help. Oh. I lost my train of thought. I'm very, very, very loyal to those three agencies. Very, very, very loyal. As a matter of fact, that's the reason why I'm speaking today, and it's coming from the heart. I don't have any cue cards. I don't have a written script. I'm just telling you what happened and the position I was in and how I felt at the time that I came in contact with Help Me Grow. One last thing. I kind of had to think about other parents and how can I help other parents and other kids, innocent kids. These kids are our future. These are our future doctors, nurses, lawyers, presidents. And there's not a lot of focus on that. A lot of times people lose sight and forget that when you're older, this is the next generation who's going to take care of you. So I've come up with this, I don't know what to call it, but pretty much it's like a 3-tiered system to kind of differentiate between the 3 types of, in my opinion, parental households, and in allocating funds and determining needs. The first one is a 2-parent household, whether it be a mom, a dad and a dad, or 2 moms. It doesn't matter, but there's someone to pass the baton to. There's someone to help the other parent. There's someone there for you to take a break, and you guys can tag team and take turns. Then you have single parents, and at first I thought I fell into that category when I first had my daughter, but then I realized that I didn't. Single parents are usually 1-parent households. Sometimes a lot of single parents think that they're single parents because they don't have a significant other, but they do have some sort of support system. They may have a mom, they may have a sister, they may have an older child who's able to help them. And the last tier, and the tier that's more, which is close to me and what I think I fall into, are solo parents. And those are parents that may have lost both of their parents or all of their family, or they may be here from a different country, so they don't have a support system. And the kids of those parents, and those parents as well, need a lot of support. And that's the category that we fall into, and hopefully I can reach someone today that can focus on help for solo parents who have no other support system other than Warmline, Help Me Grow, and the Crisis Nursery. Thank you.
Thank you. For not having a script, that was awfully good. I hope, by the way, that you're going to stay in Curtis Park. That's a great community.
I'm sorry.
I hope you're going to stay in Curtis Park for a long time. It's a great community.
Thank you.
No, this is great. So we thank her. She was here, as she mentioned, she's loyal, and she came really to just be a part of this process today. So thank you again. And thus ends our presentation.
That's a
Thank
good
you.
way to end right there. Okay, thank you very much. Any questions or comments from commissioners? Okay, thank you.
Thank you.
Okay, last item is commission member comments. Commissioner Wirtz.
Well, I don't think any of us can, that was just incredibly valuable for you to present today for us. Thank you for that. And just on another note, I don't think any of us can go through this day today without taking note and taking a moment of time to figure out what actions we're going to do around the horrible shootings that have happened across the country and in our state. And so I just want to sort of say two things. One, we know that there are lots of complex reasons, but that one of the most strong correlations in this situation is that the more guns that are available in a state or a county, the more deaths there are. That's evidence-based. But in addition, we also know what we do here is part of that solution as well, in terms of reducing trauma in our families and providing opportunities for children and families to reach their full potential so that they don't feel isolated, separated, and hate driven by the forces around us. So I just want to take a moment and just acknowledge that we all are working toward solutions toward that as well.
Okay, any other comments from commissioners? If not, I have a couple of comments. First, I want to thank again everyone, all the organizations and individuals that were responsible for Mommy Wood, the Mommy Wood event that I had a chance to attend on this past Friday with Aaron and Latina. We had a great time. It was at one of our WIC locations out off of Hurley. And it's a community resource project, right?
Correct.
And I was really very impressed with not just the multitude of agencies and nonprofits that were there to provide mostly healthcare resources for mothers and their infants, but was really impressed by the volume of our constituents that were taking advantage of such a great event and availing themselves to a lot of great information to make sure that their pregnancies are healthy and that their infants are healthy once they're born. So that was wonderful to see. And then I also wanted to make note of the fact that tomorrow is National Night Out, and I know that there'll be many events scattered across the county and our community. This is an annual event across the country where originally it was intended to be a get to know your law enforcement agency kind of event, but it's really evolved into something I think much greater, and that's an opportunity to really meet and get to know your neighbors. And we've taken advantage of it in the South Oak Park community that I represent now this will be our 5th year hosting one of the larger National Night Out events at Jack Davis Park tomorrow at 5:30. We usually have no less than about 25 county agencies and nonprofits there with information tables. We have ice cream and pizza for the kids, and there's basketball going on, and it's always a great time. So I want to publicly invite everyone here to that event, and if you can't make it to the one at Jack Davis Park, please try and attend the one that's closest to you in your own neighborhood. All right. With that, if there's no further business before this commission, we are adjourned.